There are calls for Bristol to set up the UK's first drug consumption room to help cut deaths among addicts. Charities say providing somewhere to take drugs safely would reduce the number of discarded needles and save lives as well as money.
The rooms are used in other countries but aren't legal here. A report written by Bristol City Council says that should change. Martin Jones reports.
Here in St Paul's, it's a bitter irony that addicts often inject in this graveyard. I meet a former user who demonstrates what happened recently to his best friend when he overdosed. So your mate was like shaking like this?
Like that.
He was lucky to live.
He couldn't move, couldn't move.
Do you know people who have died from overdoses?
Oh yeah, in my town, yeah. And around here, of course I have.
Every single one of these people is a human being with a family somewhere that will miss them if they die or if they suffer. And day in, day out, I'm meeting parents who've lost their children who might be alive today if a drug consumption room like the one proposed for Bristol had been available.
And drug litter is all too common elsewhere too. Near this city farm in Bedminster, popular with families, it's left by the footpath. The danger to the public evident. This park in St Paul's is regularly cleaned by volunteers to get rid of needles.
Why I started probably and have continued taking part and looking after this park is that I was getting so angry with drug use in the park and people not taking care of themselves. And rather than get angry, I wanted to transform the energy.
Drug charities claim no one's ever died in a drug consumption room. There are dozens all over Europe. Safe places addicts can inject, with medical staff on hand. And the report, written by a council officer, says having one here would save lives and money. It says drug deaths here have more than doubled in the past 5 years, and that Bristol has over 4,000 heroin users, as well as per capita the highest number of crack cocaine users in England. This local MP says a drug consumption room would help treat drugs as a medical, not moral problem.
So we already have a drug consumption room in Bristol. It's called Bristol. What I want is safety, and I want a way of engaging people with their drug use so that we can try and get them into treatment where that's appropriate, or at least advice and help, treat it as a health matter.
The problem is that even if the council wanted to set up a drug consumption room in Bristol, it couldn't. The government currently won't allow it. That's why this report calls for the council to campaign for a change in the law. But the council wants more evidence.
The report makes for some really good reading, but I think it needs to be a little bit more balanced because obviously it's a report that is kind of pro-drug consumption rooms. Now, I have my own personal view on this, but as the Cabinet lead, it's really important that there is a wider discussion that needs to be had across the city.
So it seems injecting in public and all the risks that come with that will continue, at least for now. Martin Jones, BBC Points West.
Now, Maggie Telfer is from the Bristol Drugs Project, so I asked her how a drug consumption room would work and where it might be.
Well, we're a long way from those kind of discussions, but clearly it would need to be fairly central in the city because that's where most of our public injecting is happening.
And who would supply the drugs?
Individuals supply the drugs. They bring their own drugs with them into a setting where they can use them in a hygienic place and where there's not the risk of the kind of public seeing them doing that.
Would that mean there'd be dealers outside?
Most of the centres, and there are over 100 in 11 other countries, have rules about sort of dealing around the kind of premises. So no, there wouldn't be. But people, you know, today are out there in Bristol buying drugs and it would be no different from how it is at the moment.
Is this one step further towards legalising the whole thing?
I don't think so. I think it's a practical response to a very real problem. And, you know, it's a problem in Bristol, it's a problem in any other city where we have a group of people who don't have somewhere to call their own, where they could inject drugs in privacy and with a degree of hygiene to provide a practical alternative.
Do you worry, though, that people might see this as the slippery slope, where you say, all right, we'll have a special room, well, why not then at home, well, why not down the pub, and so on?
No, I mean, again, you know, we've got 11 countries, we've got over 100 sites. None of them have any evidence of that happening. Why would it happen here?
Why is it illegal then?
Because it's using drugs in a setting which is controlled by the misuse of drugs legislation, and the Home Office so far has been unprepared to have any dialogue with any area about looking at even a pilot. You know, let's try it, let's work out and see what the benefits are and what the problems might be.
Maggie, thank you very much indeed for coming in.
Okay, thank you.